So why don't we start? Why don't you tell me a little bit about yourself and what your role is as the CTO of HHS?
So, sure. So my background, I guess in a nutshell, I really more of a software entrepreneur than anything else. I started a company, co-founded a company in San Francisco in '97, and grew that for a while. Moved over to London in 2005 to open up the European Asian offices for the company. And then in 2009, was recruited to the public sector. I got a random phone call from the city of Washington, D.C. asking if I wanted to talk to them about being their CIO/CTO. One thing kind of led to another, and I ended up doing that job, accepting the offer, and had a blast doing the job. It was really fantastic. Until about 18 months in, the mayor that hired me, Mayor Fenty, lost his re-election campaign, and so all of his appointees basically had to go find new things to do, and I ended up being introduced to Governor O'Malley in Maryland. Started working for him as the first Chief Innovation Officer for the state of Maryland. Did a bunch of interesting things there, and was planning on doing that until the end of his tenure, his next year, when I was recruited for this job here at HHS. And just couldn't say no. It was too interesting.
Yeah, it definitely looks like a very interesting position.
Oh, yeah, it's fantastic. I mean, basically, so to answer your second question, what do we do? That's actually something we spent a lot of time kind of thinking about and working on over the past year since I've been here. And really, the way I like to explain it is the following. We look for what we consider to be underutilized assets across the department and figure out how to drive more value through them with resources that we have, and in doing so create what I'd like to think of as a foundation for the next generation government. So what does that mean in reality? Well, if you look at the work that my group has done over the past few years, the main thing that we've been focusing on is this idea of data liberation and taking data, kind of breaking it free from the silos that exist within the department to try to make it more useful to help us affect the transformation of healthcare, and the delivery of human services. And we really made some significant progress on that, I think. We've been able to, I think, really change the default setting from closed to open when it comes to releasing data, and we're starting to drive more action when it comes to people within the department who own these data sets to actually do interesting things with them or get involved in the doing of interesting things with it. So that's sort of one side. The big thing that we're working on right now is this idea of what I consider to be one of the biggest underutilized assets we've got, not just in HHS, but literally across the entire federal government, which is the workforce here. We have 90,000 people at the department, spread out across any number of sort of massive organizations. And for the most part, these folks are incredibly intelligent, very focused, and dedicated. They're here for the right reasons, and they want to solve some good, big, important problems. But the way that the bureaucracy is structured and a lot of the red tape kind of prevents people from actually doing things like that. So we are in the process of embarking on a program that's designed to actually affect significant cultural change in the idea that we can then allow sort of these amazing people across the department to work their magic and really get involved in some of the things that they've always wanted to be involved in to move the needle quickly on doing things in the areas that they're subject matter experts in.
Mm-hmm. Okay. Now, what are some of the main initiatives or things that you're looking for?
Well, when you say looking for, what do you mean? In terms of programs that we're working on that we want to help them execute on, or things that we're executing on in order to kind of change the culture here?
Well, as far as, like, if I were an entrepreneur,
yeah.
And, I want to build a business, then I want to do something with HHS. Is there, like, a list of things someplace that I can look up and say, okay, well, there's an initiative from HHS that they want to go and do this, so maybe I want to go and build something like that and at least get into, I guess it's maybe like a bidding process or something.
Sort of. I mean, on one hand, we have our Prizes and Challenges program, where we sort of act as a conduit for all of the different departments and divisions across all of the different agencies and divisions across the department to help them sort of frame and publish and then run these challenges that they think are interesting to drive their mission forward, right? These could be software challenges, develop an app or a website to do X, Y, or Z. They could be video challenges or graphic design challenges, you name it. We kind of run the gamut. And so that's one way. And we publish all of those on challenge.gov. They're all kind of tagged under HHS. And in many cases, actually, we've seen those challenges result in a number of startups and entities being formed, and that's kind of one of the ideas behind it. You know, we're not putting the challenges out just to sort of solve a problem for ourselves. We'd love to see those things turn into something that's more effective and more sustainable in terms of people actually creating functional businesses. So that's sort of one thing. The other thing that we're thinking about also is trying to make this opaque world that we're in a little more transparent to people who are not subject matter experts. So it's interesting, just take healthcare, for example. What's interesting about healthcare to me is that every single person in the United States is a consumer of this system, right? And as a result, everybody has experience with it. Everybody has a story about it. Most people actually have some stories that could, frankly, point the way to improvements that are necessary in the system. But I think a lot of people, because it's such a complex system and area, don't really have the knowledge that they need to actually dive in. And so one of the things that we're working on is trying to figure out how to educate people a little bit more about what some of the problems are that exist out there and how those problems can potentially be solved with the right kind of thought. And so we're spending some time on that as well.
Okay, I'm on challenge.gov right now. So I see some links on the right-hand side. So I see stuff for health information technology. Is that also HHS, or is that...
Yeah, hang on. If you go to... let's see. Let me just navigate here and I'll tell you. Okay, so if you go to from the home page, go to the tab that says Find Challenges.
Okay.
Click that. And then on the right-hand sidebar, where the facets are, you see where it says Organizations?
Yes.
Click U.S. Department of Health and Human Services. And these are all of the challenges that we have that are out there and active.
Okay. So I see it's all down by tabs. So so that was U.S. Department of Health and Human Services?
That's right.
So it's all by pages.
Yeah, obviously you can see there are a lot.
Yeah, there are quite a few.
Yeah, no, a lot of these are actually completed, but some of them.
Oh, okay, I see. It's on page 9.
Yeah. So sorry, what's on page 9?
Health and Human Services.
No.
Under Organizations.
Okay. Sorry, what you should do is filter by organization, right?
Oh, okay.
So there's a facet on the right-hand side underneath Organizations that says U.S. Department of Health and Human Services.
Mm-hmm.
If you click that, that'll give you all of the HHS ones.
Okay. I see you have 68 challenges.
Yeah, and some of those are active. Some of them are already complete.
Oh, okay. Mm-hmm. Okay, well, thank you. So this is actually very useful for people. So they can look up these different challenges, and I guess they can develop applications or services revolving around those challenges. Is that correct?
That's absolutely right.
Yeah. Now, how do they... Is it... like a bidding process or a grant process? How does it work?
No, it's a competition.
Oh, it's a competition.
And the mechanism of the competition depends on what the actual competition is for. So, I would take a look at some of the ones that we have out there because it varies depending on the type of competition. For example, if we're asking you to develop an app, then you'll have a panel of judges that judge the capabilities of the applications that are developed compared to everything else, right?
Mm-hmm.
But there are lots of other kinds of challenges as well.
Okay. So now, if somebody wanted to get more involved with HHS, how would they go about doing that? Is there, like, let's say this is somebody's passion that they want to really work with HHS? How would they go about doing that if they wanted to?
Well, I mean, that's
it's kind of a loaded question, I think.
Well, I mean, it's a hard question to answer, right? Because
Yeah.
you got to keep in mind that HHS is a massive organization.
Right.
One way to think about it is that HHS, the sort of the Health and Human Services Department, is almost like an umbrella company, right?
Mm-hmm.
Which sits on top of a number of what we call operating divisions. And those operating divisions include places like Food and Drug Administration, Centers for Disease Control and Prevention, National Institutes of Health, Center for Medicare and Medicaid Services, et cetera, right? So I think the right question to ask is really what type of thing is a person interested in, and then how to find the right contact in the right division based on what that person is interested in.
Mm-hmm.
Do you see what I'm saying?
Yeah.
So, for example, I mean, if you're talking to a researcher, they're probably going to want to go to NIH, right? Unless they're doing research in mental health or they're doing research in epidemiology or in medical devices, in which case they'd go to SAMHSA or CDC or FDA. And so a lot of it depends on what thing it is that they're looking for and, or what they're interested in. And then the question is how to navigate to the right area. Now, one of the things that my group does help with is helping people in the outside world navigate to the right areas.
Mm-hmm. Yeah. Okay. So, is there anything else you would like to? Oh, well, what do you think about the future of health tech? What do you think are some of the great innovations that might be coming up within the next couple of years or so?
Crystal ball time. I mean, we're sort of at a really interesting moment in time where technology is enabling things that we couldn't ever imagine, right? And so everything from personalized medicine, I think, is picking up steam rapidly, to the idea of even personal tracking of health data and using that to affect change both personally and sort of system-wide, I think is a big deal. The fact that the Affordable Care Act is fundamentally changing the way that healthcare is provided in this country is a massive change and transformation in the system. And so I think with those three things, you really see you're going to see a massive ecosystem start to get formed around enabling and affecting this transformation, mainly because we have a $2.8 trillion healthcare system in this country, which by all accounts is broken and needs to be fixed. And so that's where the disruption is, I think, going to come from, and where we're sort of sowing the seeds for that to happen.
Mm-hmm. Okay, well, thank you. Is there anything else you'd like to say?
No, I think that's good.